भारत एक युवा देश है। विश्व में हमने युवाओं की आईटी एनर्जी के माध्यम से अपना एक रुतबा खड़ा किया है और भारत इसके बाद के लिए गर्व कर सकता है। दुनिया में हम आंख में आंख मिला करके बात कर सकते हैं और ये मेरा साथ मैं हमेशा कहता आया हूं, आईटी प्लस आईटी इज इक्वल टू आईटी। इंफॉर्मेशन टेक्नोलॉजी प्लस इंडियन टैलेंट इज इक्वल टू इंडिया टुमारो।
Good morning to one and all present here. I would like to ask Mr. Karthik Sharma, the head vertical of government and pharma of Elets Technomedia Private Limited, to give the introductory remarks.
Good morning everybody, and I welcome all of you in the second Healthcare Transformation Summit 2020. eHealth magazine is from last 16 years writing about healthcare enterprise and healthcare innovations across the world. And we are one of the most read and renowned magazines in the Asia Pacific region writing about healthcare. And we have done hundreds of events across verticals and across various aspects of healthcare in India and in various parts of the world, promoting the innovations in healthcare sector. We started in this COVID-19 pandemic. We started the virtual event series of healthcare, and this Healthcare Transformation Summit second edition is part of it. The first edition was very successful in last quarter, which was inaugurated by Minister of State for Health, Government of India, and various participants participated in it, and it had several great outcomes of that conference. And today we are starting with the second edition of Healthcare Transformation Summit, and we are very, very glad and honored that many eminent personalities are joining us for next 2 days in this summit. And I would like to tell you that we are having more than 65 speakers in these 2 days, talking from various parts of the world, talking on various different aspects of healthcare. And thousands of people have registered to join this summit as delegates. And we are very thankful for our partners for supporting this event so that we could finally do this event here virtually. And I would like to just mention our partners. This event was supported by Mylan Pharmaceuticals, and the platinum partner was Glenmark, and in association with Amazon Web Services. And our gold partners are J Mitra and Company Private Limited and BPL Medical Technologies, and our supporting partner, Decisive Edge. And we are very, very thankful for, and our government partners are NIC, Government of India is our partner, and Ayush Department, Government of Uttar Pradesh is our, these two are our government partners supporting this event. And in the next 2 days, we will have discussions on various topics. In this inaugural discussions, we will have one keynote address and two industry experts talking about healthcare scenario, and then we will have various sessions like future of EHR in healthcare. Then there will be a session on National Digital Health Mission. Then there will be a session on health tech investments, healthcare beyond 2020, the importance of data, and then there will be a session on integrated infectious disease capacity building. Infectious diseases, there will be a specific session. Next day also we will have various sessions on treatment of COVID-19, right drug to use, right treatment to use. And then next day, realities, IoT, machine learning, robotics, and we will have sessions with experts on that also. We will have sessions on diagnostics, we will have sessions on e-payments in hospitals, and we will have sessions on telehealth and infections control and public health. And we will have HR managers of top healthcare entities of India in the last session of day 2, discussing on the enhanced value creation and improved experience in healthcare business through HR partnerships. So it will be a wonderful discussion throughout the 2 days, and I request all the audience which has started joining to please keep stay there for 2 days for all the sessions. You will love it. With this introduction, now I will request Dr. Ravi Gupta, who is the founder and CEO of Elets Technomedia and also the editor-in-chief of eHealth magazine and all other publications of Elets, the person from last 18 years who is working on promoting innovations across the world and has done fantastic work. And we all are working in his guidance and leadership to promote innovations, at least in country and in the world. So I'll request Dr. Ravi Gupta to please deliver the welcome address.
Thank you, Karthik. I welcome all the speakers of the inaugural session, all our eminent speakers. So thanks for joining us, and all our audience who are watching us live on our 3D platform, where we have a 3D experience of this event. So those who are not yet logged on the 3D platform, I am requesting you all to go on the event website, which is hts.eletsonline.com/live, and you have the link to attend it virtually, where you can have a 3D virtual experience of the expo and also of the conference, and one-to-one networking between the participants and the exhibitors is happening. So this is an amazing event. As you all can see in the agenda, the range and the topics of the sessions, we are covering the length and breadth of the various aspects of the healthcare. And as we are all aware that COVID-19 has changed the world completely, and of course it has impacted the healthcare sector in a big way. From the government focus on the health sector, which has drastically increased, the government's focus for helping the private sector, which is working in the health arena, that support has increased, and overall awareness of the common man for health has dramatically increased. So in this background, this event becomes very, very important, where we discuss various emerging scenarios in the health arena, in the next uh, 2 days. And also, um, I would like to inform all our audience that after the lockdown happened because of the COVID-19, Elets is one organization in this country which reached out to around 200 decision makers across the country, IS officers, secretaries from various departments, municipal bodies, DMs, and of course the hospitals, CEOs, CIOs, and we did webinars from April 2nd till now, and we have done around 250 of them, and try to document the various concerns of all the sectors of the society and how are they dealing with the COVID-19 situation. I would also like to inform all our audience that yesterday we have launched another initiative called Panacea, which is looking at giving workshops in the field of yoga, mental health, and nutrition for the COVID-19 affected people who have recovered but still are struggling with the health issues. So, the commitment of e-health and Elets towards the health sector is huge. We and our team are deeply committed and passionate about health care innovations, and we look forward to your uh, continued support and guidance in making our initiatives better. With this, I welcome again all our eminent speakers and delegates who are right now logged in on our 3D platform and on our social media. And again, I'm mentioning the website of the event. Karthik, I request if you can write it on the chat here, so that people can log in on the 3D platform and have a 3D experience. So with this, I'm handing it over to my colleague Pratibha Raju, who has curated this event in a very, very nice way. Pratibha, over to you.
Thank you so much, sir. Thank you for those nice comments. Without further ado, let me start with the session. I'm very happy to begin the second healthcare transformation summit. We had put in a lot of effort in the, each session and the, topics which we have done. So we'll be doing like this. We'll be first Dr. Saurabh Dalal, the National Professional Officer, Emergency Risk and Crisis Management of World Health Organization, India, will be talking about pandemic 2020, the journey so far and the way ahead. It's a very important topic. We are all in suffering for the past 6 months, and we are gradually navigating from this pandemic. But World Health Organization has been leading all the nations across globally, and to get out of the pandemic in a right way. So Dr. Sarab's address, we are all looking forward to. First, we'll have Dr. Sarab, and then we'll have Mr. Praveen Nagpal, the COO of BPL Medical Technologies, who will be also presenting, about the various technologies, and he'll be having a presentation, followed by Mr. Sandeep Sharma, the CEO of Decisive Edge India Private Limited. Without further ado, I would like to call upon Mr. Dr. Dalal for his keynote address. Thank you.
Good morning, everyone, and namaskar. I am Dr. Saurabh Dalal, the National Professional Officer for the Emergency Risk and Crisis Management with the WHO Country Office from India. And I'm also the UN focal point for all UN agencies for COVID 19. So, a very warm greetings to the dignitaries and the attendants of this particular conference on Healthcare Transformation Summit 2020 from the World Health Organization Country Office for India. As we are all aware that we have been in this pandemic since the beginning of this year, and it has been a tough time for every one of us. We have seen and we have learned so many things in our recent lives that probably would take around decades to learn and unlearn. With this, there are many positive changes also happening around, especially when we talk about the improvements and the policy accelerations that are happening in the field of healthcare. is going to stay for long, and we are very much positive about the outcomes after the pandemic, how our healthcare systems will be strengthened, and what will be the final shape up of the future healthcare scenario within our country. With this, I would like to also give you a brief overview that we all have been working very hard to deal with this pandemic across the country, and we are also getting time to time international guidance. India is also a very active part of the global solidarity trials and the vaccine trials. So it is not that I learn and I keep it to myself. It is we all learn and we share it to everyone across the world. So these are several key learnings that each and every country uh, probably have learned from each other, and then have fine tuned their policies and the response to COVID-19. Uh, if you are all aware that there are around 2,600 WHO field personnels across all the states, hospitals, in cities, districts, and even in union territories, and they have been day and night working hand in hand with the government at the lowest level until the highest level. And even with the WHO country office for India, we are committed to work with our prime partner, Ministry of Health and Family Welfare. But apart from that, with all other stakeholders like Joint Monitoring Group in the Ministry of Health and Family Welfare, the 10 empowered committees that have been formed by the Honorable Prime Minister. We are working very closely with the Niti Aayog, NDMA, and several state government and UN agencies in this COVID-19 response, along with the several diplomatic missions and other private sector agencies as well. So this has been an overall a very huge and a very unique learning experience for all of us. COVID-19 has taught everyone a very unique deal of things which probably it is very difficult to highlight in a normal ongoing scenarios. Right from the importance of the international health regulations and the global policy guidances for health emergency and disaster risk management, we have came along a long way by institutionalizing all these global concepts at the local level. So as we grow in future, we have to definitely assimilate all the learnings that have we have gathered. And COVID-19 has been a continuous learning process. We grew as we learn, because things with regards to this particular virus were not very clear right from the very beginning. So eventually, when the sequence of events unfolded, we got to learn a great deal about the virus and its behavior, its characteristics, and its manifestation. And still, we are in a learning phase, and we have come a long way across this. There were many first, and there were many news which we have learned for the first time, probably which we could not have been referred in the medical traditional textbooks, and also the lessons that the other stakeholders other than the healthcare sector have learned with regards to the importance of healthcare have been very very vividly and extensively highlight. One thing which we everyone is acknowledging is nothing has to be taken for granted now. So we have to be very very peculiar about what decisions we make, what route we choose, or how much we invest in the preparedness, how much we give importance to our health. And at the same time, no, it is not just government doing everything, but even at an individual level, each and every person has realized this particular fact, that paying an utmost attention to the health, as in our the we in a very old traditional proverb we say health is wealth, has now come true in a very very realistic sense. uh, at the same time, India as a country, we witness not just COVID-19, but many, many coexisting disasters and emergencies that took place. Probably many of them, right from two cyclones striking at East Coast and the West Coast. There were floods in states of Bihar, Assam, Odisha, and also there were several chemical emergencies that took place in Gujarat, Madhya Pradesh, Andhra Pradesh, and at the same time, and also hospitals getting having admitted COVID-19 patients were gutted by fire. So probably these were the emergencies which we never anticipated, but that came along our way. And then it becomes very difficult not just to manage this particular emergencies, but also to manage their cascading effects and risk. So, and this effects of those cascading hazards amplify the risk of COVID-19 also by multiple times. For example, during the flood season when or cyclone where massive evacuations happen, it becomes very, very difficult for the government and the administration to ensure social distancing, compliance, personal protective behaviors, and many other issues. At the same time, the poor and the vulnerable in those particular areas are also at very high threat of getting infected by COVID 19. But there were certain things that every state, every district level government, and at the national level also we have learned in a very, very positive way. One of the very positive prime thing that came along the way and which was one of the major savior was technology. Technology now literally we can say that has changed the way we live. So if we see the implications of technology and innovations in management of COVID-19, the contribution of the overall IT sector and the technology has been huge. Each and every state developing its own COVID-19 dashboards and integrating it with their data mechanisms, coming up with a high-end command and control structures and development of the portals like S3 integrated disease surveillance program and integrated health information portal, as well as the HMIS portal at the national level, was very, very useful and came in very, very handy when we started managing on a war level for the management of COVID-19 at the even the national level. Then one of the savior that came along our way and has been immensely useful for millions of people of this country was the Arogya Setu app. The Arogya Setu really was a game changer in COVID-19, right from spreading awareness to make it right, bringing your safety to your mobile device, alerting you and also making others aware about your status was really a game changer. And implementing that in a country like India and improving it over the time. Look at the number of revisions that Arogya Setu app has gone through. So probably that it is the thirst of the Indian subcontinent to constantly reinvent itself, and then making the app better every single time. It has reached a certain level where it is very, very useful, and it is adequately publicized as well. So this was one of the most commendable thing. The second thing which we were most afraid of, but at the same time that was our only way to go, was social media. Social media was also one of the most important game changer in spreading awareness with regards to COVID-19. And I must commend all the major social media platforms like Facebook, Twitter, or be it any other social media platform, which have really come forward and done a great job in spreading the awareness and also popularizing the only right facts that were from the credible websites across the country, and at the same time curbing and removing as well as creating a huge amount of awareness regarding the infodemic spread and also the fake news and rumors that were spreading around COVID-19. So the social media took a very positive step, and also the people that were not we could not imagine could be have been reached have been made sensitized about this particular COVID-19 in a way which we all wanted, in a very easy language, in their own dialects and texts, and in their own languages have been done. We were only able to do it by social media. We If this was a scenario 5 or 10 years back, we could never have imagined that training could happen virtually. Digital training platforms and teleworking solutions have also played one of the very, very immense roles when we came across and started right from the very first training that we started from the national level for imparting was through the digital media platforms, and the national COVID trainers workshop and all the workshops that followed on at all the district level and state level were all virtual. People were very easily adaptable to that, and every time we had very huge numbers and a good turnout. When we did the evaluation of the knowledge retention through these social media platforms, it was as equal as the face to face training. So this showed that this social media virtual training platform would be a trend to is which is there to stay and would continue for a very very long period of time. However, at the same time, what we need is innovations and also bring something new, so that the retention of the knowledge and integrating of skill sets through online trainings can also be improved. One of the things which was not getting much impetus from a very very long period of time was telemedicine, which got a very great impetus. And now, as I envisage the scenario of telemedicine in future, it it is here to stay for long. Telemedicine, coming out with government coming out with specific policies on telemedicine, and also regulations and guidelines around it, is going to bring a lot of change. For example, one of our very prime initiatives on hypertension control is now being rolled out through the telemedicine network across the country, and the India Hypertension Initiative is gaining a huge popularity. At the same time, in when we talk about the healthcare, there is going to be a lot of change in the models of the healthcare system. People, when we grew towards the multi-speciality and a tertiary care structure, at some point of time there was an undermining of the government and the primary healthcare model, which again is going to take a priority, and improvisations of the healthcare at the doorstep is going to happen in a very very long run. But these changes are sure to come, and we have to revisit our old models, strengthen them, and make them more functional and better, at the same time very cost effective, modern, and digital. Some of the digital technology aid that came along for as a very handy tool during the COVID-19 were contact tracing and digital systems for tracking of people, and then using those all investigation for disease surveillance, and then for enforcing quarantine and home isolation as well. So technology has been an immense savior. You can just kindly imagine, if technology would not have been there, the world would have been chaos with regards to COVID-19 management. And it is not yet from over. There is an immense data infrastructure which is now being geared up and set up for the logistics and distribution of vaccine. So the vaccine chain management and supply chain management is also going to be a very very important key in the when, as we see the pandemic near its end. But digital technology, even in that arena, is going to play a very very important role. So what we have seen on three fronts is, we, I would term it as PPT, PPE, and PPB. So the PPT eventually phased out and it became a subcomponent of the learning platforms. So PPT would not stand very relevant in futures, but definitely the e-learning methodologies will change a lot. The personal protective equipments, which never gained much importance in the past, are now becoming a very very important thing for every healthcare worker across the country, and are were the main saviors. Look at the way that India as a country has ramped up its capacity, its manufacturing capabilities in terms of PPE production, the ventilator production, and its self-reliance through various initiatives of the government India, and we are on a commendable track in that way. And the one of the most important thing, which has been a savior for the entire nation, and which is going to play a very important role even in future, is PPB, personal protective behavior. Unless COVID is yet far from over, so unless and until we don't adhere to personal protective behavior like social distancing, wearing of masks, and adhering to the norms when we go outside, it is going to be difficult if we don't follow these behaviors. So with upcoming festive seasons, upcoming winter and influenza season, increase in level of air pollutions, and at the same time changing in the trend, anticipating that vaccine would come, but we cannot lose our guard down. And that has been adequately emphasized by our honorable prime minister as well, that we have to be very careful and very very vigilant as we were in the initial days as well, just to make sure that not just us but everyone around us also remains safe and remains protected. There is a huge expected and anticipated change in scenario with regards to the healthcare delivery, and the way we deliver take care of our patients in our hospitals is also going to change. So I am very very hopeful that the leaders who are going to attend this conference and are going to share their vision with all of you are going to give a new direction to the entire healthcare system within the country. And also at the same time we all have to come together and in a very more and better way and with robust mechanisms to share our experiences with each other, to make the healthcare as one and more reliant on each other. For example, the issues like referral from a government hospital to a private hospital, the issues with regards to insurance, and a lot of issues with regards to the last mile delivery of healthcare in rural areas. So there are a lot of solutions which now we already have in our hand. We just need to recustomize them to for the better implications and applications, and then they can be used for the benefit of one and all. So with this, I wish this particular summit a very very good luck, and we would be a part of this deliberations in future as well. I once again thank the organizers of this particular event, and all the partners who are going to be there in this particular summit. Thank you. Jai Hind.
We know an informatic cannot be eliminated, but it can be managed. And I hope India is doing well. In past 6 months, we have been doing well, and each and every aspect which was brought in by Dr. Dalal was done. The technology has been pushed in healthcare, very much, and digitization is happening in a very good way. Thanks a lot, Dr. Dalal, for your time and this address. It was really important for us. Thanks a lot. Moving on, I would like to have Mr. Praveen Nagpal, the CEO of PPL Medical Technologies. Sir, with your presentation, we'll start now. Yeah.
Yeah, so shall I share my screen for the presentation?
Yes, sir, you can.
Okay. So good morning and namaste to all and everyone. I thank, Dr. Ravi Gupta for this healthcare transformation summit, which is, a very important thing, especially at these times, and the way, healthcare is getting noticed over last many decades in India, and the way it's, expanding. Uh, the summit is healthcare transformation. So let's see, from the industry perspective, uh, what we are doing. I just share my screen and the presentation there. Yeah, if you all can see that.
We can't. Deepak, can you help us? Yeah.
Yes, sir. So just go with this share screen
I did
and select
that.
the application window. Hello.
Yeah,
Sir?
I have done it. If you can do it from your end, I think it's not happening.
No, sir. You will have to do this from your end, sir. I can. So just do it again, sir. Just go
Shall
with
we
share
just
screen.
share the screen option?
Is it seen now?
Not yet, sir. Not yet.
Okay.
Techno- Technology is good, but it comes with certain limitations. Yeah. We are there. Like, yes. If you could just share the screen. Yeah.
Yeah, is it visible now?
Yes, sir. You can. Yes, sir. Yes, sir. It is.
Okay. Looks like it's some technology issue. Okay,
Yes. Yeah.
so uh,
We can see the screen, but
okay.
Sir, now can you, if you can do the full screen of
Looks like
be
some
visible.
challenge in, yeah. Sure.
If you can click on share screen,
Yeah.
and then you click the screen which you see. If you click on the application window, and if you click on your PPT and then click share, it will only show your PPT.
अपना कंप्यूटर लॉगिन कर. Okay, I think there is some challenge that PPT is not getting opened.
It is opening, sir.
Okay. Okay.
We can see
So
the PPT. If you just full layout kar dijiye, sir.
it's not moving, probably to the next slide, some challenge. Can we do the second participant, and I'll log in again? I think looks like some challenge.
no issues, sir.
Sure.
We'll
Yeah,
wait.
yeah,
Thank
yeah,
you.
yeah. Thank you.
Yeah, let's move on. I would like to welcome Dr. Sandeep Sharma, CEO of Decisive Edge Private Limited, with his presentation. Dr. Sandeep, can you please unmute yourself? Yeah.
Am I
Yeah,
audible?
let's begin with your presentation. Yes, sir, you
Sure.
are. Please go ahead.
Okay. All right. So, very good morning to all of you. I'm Sandeep Sharma, representing Decisive Edge Technology, and we are happy to associate and partner with the Summit at this time. We are a solution engineering and technology services company, and we focus primarily on healthcare and financial services. We have offices at Pune, India, Toronto, Canada, with headquarters at Newark, Delaware, USA. In healthcare segment, we have launched a product named Fifth Port in the US market, which is a patient engagement platform used for education and consent monitoring. In the COVID times, it is also getting traction from the huge number of clinical trials that are going on. In India, we have been working to help hospitals in their technology transformation journey and plan to launch ProMedic, a hospital information system framework, early next year. I feel Healthcare Transformation Summit is happening at a very crucial time when there is a need to examine not just healthcare, but almost every industry and come up with a transformation strategy. We have an opportunity to rebuild them better than before. Pandemic has had adverse revenue impacts in first half of this fiscal, but preventive healthcare cannot wait forever. And COVID-related treatment will remain another stream in near future. To overcome the challenges and take advantage of the opportunity at hand, hospital industry needs to unleash an overdose of digital era for next 2 to 4 years. As we are dealing with the decoding the digital era of health. So I really feel the time is here, and that is like next 2 to 4 years when hospitals have to really go in overdrive. So let me talk about some common challenges faced by hospital industry, core reasons behind them, and possible solutions as seen from an IT perspective. First and foremost, patient experience remains to be compromised. I think there are no two views on that. The whole process from filling a hard copy form to providing documents remains complex, which sometimes may entail visiting multiple counters, and those documents may not even make it to the central system. After initial formalities, an OPD patient would occupy the waiting area, oblivious to how he or she is placed in the queue. On the other hand, an IPD patient may be waiting to get a clear picture on availability of the desired room type. As footfalls increase, wait times keep going up for various reasons, including and not limited to doctor-patient ratio, scheduling, or simply managing the queue. Billing accuracy and promptness could also add to further wait time and presence of unwanted patients in an enclosed area, which is linked to patient safety again. With increasing consumerization of healthcare, patients look for offers and discounts and all sorts of things, and systems are not capable to handle the same, leading to manual interventions. Administrators must continuously monitor key attributes for efficient operations. In absence of forecasts, trends, utilization reports, decision making becomes more subjective. Beds may go unoccupied while there are patients waiting for one, if the systems are not communicating dynamically. Essential drugs to regular consumables, everything needs to be stocked at appropriate levels to avoid blocking cash in unnecessary purchases. Financial reconciliation remains a big headache for the hospitals. With increasing penetration in healthcare insurance, majority of the revenue comes through the insurance cases. Claim settlement remains a lengthy process, stuck in submitting case papers in offline mode. When the consolidated payments are received finally by the hospital, there is added challenge to map them to individual patients. Doctors, as we know, are the backbone of the hospital, always short of time and engaged through variety of operating models, from permanent roles to contract roles to hourly models. These engagement models keep evolving on a continuous basis as per the need, but systems are not able to keep up with these flexible models, leading to counting errors. So let me move on to the next slide. Having talked about the challenges, let us look at some of the core reasons behind these challenges. So as we see, technology is one of the biggest reasons that is linked with lack of investment. Budgets are consumed primarily on regulatory compliance initiatives, medical equipment to meet expansion plans, thus leaving IT infra surviving on old technologies. It serves as a double-edged sword. On one side, the out-of-life technologies could pose risk to patient safety and entire IT operations. While on the other side, innovation and value-added initiatives cannot be executed in absence of desired baseline technology stack. While some hospitals seem to be performing well in isolation, they have limitations in sharing information across facilities within the same hospital network. This adds to patient problems while trying to get service from separate facilities and creates issues in consolidated reporting. M&A, as common these days, also becomes a trigger to interoperability issues, with merged systems having limitations in exchanging information across the entire organization. Some systems give an impression of being integrated, but actually, as you look closely, manual steps in between become integral part of that end-to-end process. The hospital contracts with numerous insurance providers and multiple third-party administrators present a complex scenario. that could best be dealt with an automated process. Patient discharge process for insurance cases stretches for the need of formal approvals, which further impacts patient experience. Claim settlement period could run into months, causing delays in receivable collections. Hospitals have no choice but to have a dedicated team to handle outstanding insurance claims and coordinate through Excel sheets, emails, and phone calls. With this, I'll move to the last section of my session. And this may be high time to give a serious thought and design a customized transformation roadmap. Answer to these challenges lies in an integrated, configurable hospital information system that maintains a central patient registry. Patients could avail services from any facility in the network without having to share information again. Information is made accessible to all facilities for patient administration and billing in a seamless manner. A queue management system could ensure presence of only desired patients and keep them informed how long it might take for their turn. QR coding of medicine, consumables, and other material could make it easier in tracking inventories and timely replenishment without overstocking. Direct interface with TPA systems will allow desired patient information to flow automatically for submission to the TPA. With TPA in sync dynamically with the patient's diagnosis and treatment, final bill settlement happens quickly without delaying patient discharge. Better receivable collection leads to improved cash flow for the hospital. Operation theater and costly medical equipment are not available in plenty, even for the biggest organizations. A scheduling system could ensure that doctors and staff can check the availability and book necessary resources and assets as per the procedure planned to be performed. A robust management information system could provide comprehensive reports with drill down ability to the executive management administrators. These dashboards will provide dynamic information about patient experience, operational and financial parameters, and enable informed decisions. Digitalization can truly shift the focus from dealing with volumes of data to delivering the value automatically. Just take an example. A patient planning for a procedure visits hospital to get the estimates. The estimate is arrived at using various predefined packages and multiple other factors. An AI ML driven model could be used here to compute more accurate estimate using historical data for the same procedure, same gender, same existing preconditions, and many more such parameters, which just overrides manually, looking through these packages. So as I come to sort of towards the end of my session, I would just like to highlight that Decisive Edge has been studying hospital operations and addressing these challenges for several years now. We realize that hospitals deserve a solution that can meet 100% of their needs and not just an off-the-shelf product. If you're dealing with any of these challenges and want to discuss your options, we are available. You can contact us. I thank you for your time and attention and enjoy the rest of the conference. Thank you so much.
Thanks a lot, Mr. Sandeep. That was a very good, rounded PowerPoint presentation on how automation is important in necessary in hospitals. A streamlined, automated process in every other hospital is also a patient need nowadays, and optimized, utilized resources is also needed. I think it was a very good presentation which the hospitals are looking into, and future hospitals will is actually transforming, and I hope soon all these things would be like streamlined, like as you had pointed out. Thanks a lot for such a good presentation.
Thank
Now
you.
we'll move on to Mr. Ravi. Yeah, Mr. Ravi, I hope we are all set, right? So let's begin with Mr. Ravi's presentation.
Yeah. Thanks, Pratibha. Thank you so much. And yeah, we had some technical glitch. I'm sorry about that. Uh, I'm thankful to this session, as I said, Dr. Ravi and his complete team to running this healthcare transformation summit. We are talking about transformation. So let's understand from the industry point of view what we are going to do. So if I may say next slide, please. Yeah. So first we should see that what scenario we are going to look at. If we see that the number of beds per thousand population, India is around 1.1 beds per thousand population, which probably, if you see compared to some of the growing economies and already stable ones, there is a gap to fulfill. Public health spend is also low. This is increasing over the last decade, but yes, still it is not there. In terms of private health spend, if we talk about this is at 3.3%, whereas some of the developed economies are talking about 7 to 8%. Again, there is a lot to catch up around that. And per capita spend on healthcare is $50 to $60. And again, in last few years, it would have come further up. But again, the scenario says that India has huge opportunity to work on healthcare and provide healthcare to the masses at large. Next, please. So let's talk about India. So in India, there has been considerably, improvement happen over last 70 years after independence, if we may say. The life, expectancy was very low, and now we see that, it averaging around 65 years. And this is much more than, where we started at the time of independence. But again, if we again compare it with some of the developed nation, we have something to catch up around. Beds are also low, but increasing. We talked about in first slide, but healthcare spend is continuously increasing. Even PPP adjusted, it's also growing with about 10 to 11%. But again, a large effort has to be done around to see that we uplift overall spending and see people get more healthcare. Next, please. Now, if we see the demographics, how healthcare facilities are there in India, urban and rural divide. Urban, we have 33% population, and rural, we have 66%. This is changed a lot in last 2 decades. Hospitals in rural are still lower than what it is in urban. That means the gap is huge when it has to be served for rural India. In terms of doctors, we don't see that a lot of doctors are available again in rural. Whatever limited staff we have, they are present in urban area, and beds also has the same situation. So this again tells us that the divide between urban and rural is huge, and we need to do something different to see that how we transform our healthcare in this country. Next, please. So, as we are talking about, telemedicine is a huge thing for us when we need to connect, and especially a change which has happened during COVID time. We have seen that the acceptance of this telemedicine, which we were talking about from last 2.5 decades, has moved a lot. We are seeing that globally there is a huge market, which is about $8 billion market for both clinic as well as home health. Whereas in India, it's still at about $500 million a market, which is growing very strong, but looks like there is a huge scope, especially when about 16 to 17% of world population is residing in India. Now, when we talk about telemedicine, there are many aspects which has to come together to see that patient gets a lot of success. It is engineering team has to come. It is medical staff and service team has to come. IT team has to come and see that we have proper infrastructure created, and some of the times that the user itself has to be well equipped with understanding of how this will work. So there has to be a huge learning curve for us, and I'm sure the industry and all the partners has to come together and do this. I think there has to be some kind of an effort at the government of India level, which I'm sure Niti Aayog and others are putting a strong effort in bringing all these departments together to see that we are successful around this. Next, please. So, how's the maturity of our ecosystem? So, if we talk about improved accessibility and affordability, if we talk about how the healthcare has to be provided to people, so some scenarios are changing. So we see that there has been significant change that not only urban but rural India is also getting healthcare. The insurance is coming up very strong. Healthcare is getting better each year. We also see that the people of India are young, but the huge population is aging as well. Uh, the propensity to pay for healthcare is also getting better, and we also see that the huge disease burden, from cardiac, from cancer, or any other lifestyle diseases, that's prevailing and that's increasing. So there has to be these diseases has to be addressed around that. Rural, as I said, telemedicine will play a big role. What medical device companies can do here? Medical device companies can bring those products which are high in productivity, which helps the users, which helps the customers to use them, or even the patients. The users at the B2C level also are able to use them for their well-being. The R&D efforts are increasing in country, which ensures we bring the affordable products at the right price points, at the right features, and most important is there are a lot of personalization based on the demographics of Indian population, and that's possible through India. So I think all this has to work together as a framework, and see that how we can transform healthcare, how we can improve the accessibility and affordability of healthcare to the country. Next, please. If we see that what's the India device market, we say that it's about $8.5 billion coming from patient aids, instruments and appliances, diagnostics, and many are consumable. This includes services from the hospitals. All are growing very strong for about CAGR of 15% over last 6 to 8 years. It also tells that there is a slight upper hand of uh, patient aids. That means the home health is increasing very strong in India. Not all hospitals can take the load of patient care, especially when patients are able to pay more and more. There has to be certain interventions which needs to be handled at patient's home. So home health will play a big role in coming time to see that patients are coming for secondary or tertiary ailments to the hospitals. Telemedicine plays, and then they are able to manage their diseases at home as well. So that's how we see that the trend will continue, and the growth will come from all the areas of healthcare domain. Next, please. So how BPL is playing in this scenario? BPL is a more than 50 years old organization. It's strong in India, as well as having some of the relationship by acquiring few companies outside India. We have a lot of products, especially on diagnostic cardiology, critical care, women and child, imaging, home care, and consumer. And in all these products, we are ensuring that we understand the pulse of the country, whether it has to be a connected device, whether it has to be in home health, whether it has to be, bringing a lot of productivity for our users, while ensuring that we reach out to rural. We are able to take care of all the segments, whether it is value segment or performance segment or its premium segment, which probably would be required in some of the tertiary hospitals. So our products are mix of all, so that we are able to cater all across country and see that these are fulfilling the requirements. Our production is at Palakkad, which is a strong factory there, which is ISO 13485 factory. We have a strong distribution network all across, and more than 700 feet on the street to see that we are reaching to our customer as they require us, and all the clienteles what we have. A lot of awards and recognitions what we have. One key thing for this is when you sum it up the requirements and you start acting on that, you need a strong team, and that team needs to be skilled. That we do a lot, ensure that our team is skilled enough. At the same time, we also participate with customers, because they are also, we have seen the learning curve. The features are there of the product, the technology is changing. They need to understand, from the doctors to the paramedic staff to nursing to the technicians, all of them who are using these products and devices, they should be skilled enough to utilize this products at their highest productivity levels. This is one key thing, that as a company we are ensuring that we touch every aspect which is required to make healthcare successful in this country. Next, please. So as I said, we play in 6 verticals. We have a lot of products which are going into the hospitals, which are going as a critical care segment, which ensures that we get the right parameters from the patients, and then we make a plan to provide services. We are working very closely with the clinicians and the various hospitals across countries, whether it is standalone or multiple chain hospitals across country, and we provide them right products for their requirement. Next, please. A few of the things which we have brought in, like we have brought an ECG, which is providing automatic interpretation. That means you need not to be having a consultant who's like cardiologist in this case, and he has to report. He can always view it later and do that, but this equipment can provide automatic interpretation. We have put those kind of software, so this tells that this can reach to any place in the country. We have defibrillators. It is having multiple features, various features, which helps that the productivity from this one device comes out to be very unique and in multiple areas. We have patient monitors. Again, these are very important monitors, where the GUI, the software parameters, and so many things are very unique to Indian conditions, and I'm sure this is going to help our patients a lot. We talk about X-rays, whether it's a rural area where we have fluctuations in terms of infrastructure, in terms of electricity, and so on. These can work very well. And in terms of digital offerings, where we can, like in case of COVID, where within 3 seconds we can identify whether a patient has COVID or not, and that can bring a lot of speed in diagnosis. And a very high-end CM machine. These are few examples which tells that which direction we are moving, and how as an organization we are trying to transform and see that India at large gets a lot of benefit. Next, please. This is our ISO 13485 factory. We have production line. The staff is well trained. They understand that products are well tested. A lot of equipments are there, which can ensure we have the right product coming out, right certifications, whether it is BIS, AER, BOC certifications. Those are very much there, and a huge production capacity from our factory to see that we are able to fulfill the need of the country. And I'm sure this is going to help us a lot in next few years, and this is going to help country at large. Next please. So I think we are, as an organization, staying committed on growth of medical devices and medical sector in India, and we will partner with all the service providers and see that we actually are able to transform the healthcare in country. Thank you so much. Thank you.
Thanks a lot. It was a very nice presentation where we can see how BPL is, moving towards helping the hospitals and the medical tech industries. I have a question to both the panelists here. I wanted to know, like, how the pandemic has expedited the growth of India's, be it medical tech industry or the, automation in hospitals, like what Decisive Edge is doing. How, the pandemic has expedited it, and how we would, take it in the future post COVID. What kind of repercussions would be coming in, good ones? If you could just help me with that, Mr. Sandeep, if you can go first.
So I think as we have seen closely, there is much more focus and interest in terms of seeing the dashboards and reporting. The things that were not critical earlier have become much more agile and flexible now, and there is much more demand and focus on them. We had to create on the fly dashboards on specific requests as the COVID wards got created, and there was always dynamic situation about the bed with oxygen, the bed in ICU with oxygen, the bed in ICU with ventilator, bed outside ICU with oxygen. And so there is an understanding and agreement or acknowledgement to that extent that in these times, in coming times, you got to be prepared and agile, and you cannot ignore things.
Oh, okay. And your points, Mr. Nagpal, on this, like how the pandemic expedited the growth of the Indian industry. Yeah.
The whole infrastructure understood from the country level, as well as the service providers also, and huge effort is has to be done in terms that we bring the skill, we bring those products, and we are able to prepare for the best and the worst. There has been significant growth in terms of what's required, especially for critical care and COVID related items. And I'm sure the pandemic settles down, we will have a similar growth coming for all other products required for all other medical interventions.
One more last question I would like to ask both of you all here. Like, what is the role of be it Decisive Edge, BPL Medical Technologies, to ensure healthcare accessibility and like keeping the technology ahead? Like, what kind of future ventures, like future innovations, which are going to happen from your side to the healthcare sector? If you can just give us a glimpse of it.
So as I gave you a very concise example, there is so much awareness among people now about preventive healthcare, and they want to really go and get procedures performed and treatment done. They're not what they were 10 years back or 5 years back. So in such situations, I think added with consumerization, everybody wants to shop around. So you have to be better prepared to offer instantly the costs and the estimates, and what is it going to cost to the patient, to the future patient. And again, as I highlighted the example, AI and ML are here to stay. Automation done, artificial intelligence and machine learning models created, whether it is forecasting demands, whether it is predicting the behavior or the requirements for your inventories, or being able to precisely project the cost of a procedure. I think there is AI and ML is going to play a larger role, as Mr. Nagpal talked about. From device side, IoT is going to play a major role as we move forward. Whether it is wearable devices and other things. So yeah, I think it connects back to the technology, as I said. If you are not upgraded to a basic level, you cannot even think about IoT and AI ML.
Right.
Okay.
So I think I must definitely say that the concept of connected health is increasing, and when I say connected health, this essentially means that a patient should be able to consult a doctor from home. They are able to measure their parameters sitting at home, or if they are visiting a hospital, then the productivity of the products is such high, including artificial intelligence, that they are able to get the results there and then, whether it's a CT scan, whether it's an MRI, or if you are working to see that as good as an ECG machine or so on. So artificial intelligence equipment should be such that they are able to give the outcome immediately. The hospitals and the service providers will use all the tools which are required, software tools, to ensure that the patient data is available. You need not to see what's the condition of the patient behalf. So health records will come as a key thing. PAC system, RIS system, IoT, artificial intelligence, and all these things will play a major role in ensuring that an overall scenario of connected health comes in India.
Okay. Thanks a lot to both of you. I would also like to mention that we have a 3D platform there, and we have our expo booths as well. I would like to inform all our delegates and speakers can go and visit it live. It's there. So I would like to ask Mr. Karthik to take over from here. Yeah.
Thank you so much to both the industry leaders present here, and they were interesting presentation from both of you. And I also tell audience that we have exhibition hall in this virtual platform, where booths of both of these industry leaders or their representatives will be present for the 2 days. So we have booth of Glenmark, J Mitra, PPL Medical Technologies, and in the networking lounge, Mr. Sandeep will be available. So I'll also request Sandeep to be present so that people can meet you in the networking lounge anytime, or you can talk to people, the audience in the networking lounge if you want to. And Elets booth is also there, so you can visit and do your queries. So Elets representative will help you out there, and you can also do the query in the lobby of the virtual platform. So please be active, keep asking questions, and please ask in the auditorium. There's an option of Q&A. Please ask questions so that our moderator will get those questions, and then our moderator will ask those questions to the panelists. So it will have help in making the sessions more interactive. Thank you so much. So now I will request to present the speaker certificates. Just give me 1 minute. We will present the speaker certificates to our eminent industry speakers present here. And I will request my colleague Deepak to showcase these speaker certificates, these certificates of being thankful to them for joining us and especially supporting this event. It is most important, and also being there and sharing your ideas and thoughts, because you are renowned speaker industry leaders and experts in the country. So we are very honored. So, firstly, we will felicitate our speaker, Mr. Praveen Nagpal, COO of
Thank you.
BPL Medical Technologies. Sir, thank you so much. And Deepak, can you please present that certificate on screen, please? Thank you so much, Mr. Praveen Nagpal, COO of
Thank you.
BPL Medical Technologies, for being there. And
Thank you.
our next industry leader, Mr. Sandeep Sharma, CEO, thank you, sir, CEO of Decisive Edge India Private Limited. Mr. Sandeep Sharma, we are so much thankful of your presence, and we present this certificate to you.
Thank you.
Thank you so much. And with this, I hand over it to you, Pratibha. And before that, I would like to thank again all our partners, all the audience, and all the eminent panelists. And we would also like to thank Dr. Dalal from WHO, who was very nice and wonderful in his address as a keynote address. Thank you so much. And over to you, Pratibha.
Thanks a lot to all the speakers, I would like to say that the next we have an important panel discussion on EHR. EHR, the challenges and opportunities. We have the CIOs of Pan India, leading hospitals joining in, and they will be giving us a good insight on EHR platform, which is very much needed in every hospital. We'll join you shortly in this panel discussion. Yeah, stay tuned.
Thank you.